As I've been the fellowship director now for 18 years, I think back about what's really made the biggest impact in my life, where I think I've been able to make the biggest impact. And I think it's really been in the patients I've cared for and the fellows that I helped to train.
I started here as a fellow. I had a lot of reasons for wanting to come to this program. In my search, I was looking for something that was well-rounded, that exposed me to a lot of different pathology, but also gave me a nice balance between, hardcore cornea things and also premium refractive cataract surgery. So I found that the Stein program really gave us a good opportunity to see both of those worlds.
I don't think I would have seen any elsewhere. For example, infectious keratitis ulcers, acanthamoeba. We had such a high volume the year that we were there, and I feel very comfortable managing those issues, especially with post-PK or post-keratoprosthesis patients. I feel very comfortable managing complexities that come with that, complications that come with that, leaks and whatnot. We also saw cutting edge techniques to deal with ocular surface disease, neurotrophic keratopathy, using new medications and being able to use your patients as kind of a control in some ways to see how they responded and how other patients didn't respond. And I think that's the greatest asset the program gave me, was how to think about complexity.
What attracted me to the Stein Eye Institute for fellowship was the world-class faculty. They're all so good at what they do and so knowledgeable. I learned so much throughout the year, not just about clinical and surgical skills, but also about what it takes to be an exceptional ophthalmologist.
So some of the ways I've been trained and getting prepared to operate in the at Stein has been through some of the wet labs we put together. Fantastic training where me and a lot of the attendings will sit down, and there'll be a lot of hands-on, one-on-one experience where attendings will go through with a donated actual eye, and we go through the entire surgery with getting all the education, all the tips and pointers that we can in a wet lab experience.
Again, going back to very difficult tertiary referral type level of care with cornea patients, melting and very difficult pathology, as well as exposure to premium cataract surgery and laser vision correction surgery. And so you'll leave this fellowship really with a wide breadth of knowledge and experience that will give you the confidence to go on into whatever else your next step is going to be.
We are the biggest eye institute on the West Coast. And so because you're part of this institution, you get to see the fun stuff. We get a lot of things referred to us from all over Southern California. And you grow because of the patients that you see here. Many unusual cases that you won't see in other places, they make you be a better clinician because they challenge you.
They attract these kind of very unique patients to UCLA. And taking care of these very unique patients certainly broadens the tool set that the trainees gain during their year here and helps them approach new and novel situations later in practice with that lens. And I think that's extremely valuable. And you don't find that at other centers where we don't have these faculty members.
The Stein Institute, I've been to Vietnam doing mission work twice. And that was with one of the initiatives brought on by Dr. Aldave, who kindly introduced me to the program. What we've been doing in the program is to try to do surgical skill exchange to the local surgeons. So not only that we are teaching them, we are giving them materials and also instruments to try to do these surgeries in otherwise situations where they would not be able to perform. We're aiming to give the skills, transfer the knowledge, and then actually leave it there, and hopefully that will flourish locally and continue the progress that we have.
I think this fellowship will prepare a trainee for pretty much whatever they want to do in their future, whether that's academic medicine. You would come out of this place with incredible credentials if you wanted to go into academia. You'll have the opportunity to work with world-class scientists on meaningful projects that will end up in peer-reviewed publications. So if that's your interest, this is a phenomenal place. We have some of the best basic science and clinical science faculty in the world right here. So if you want to springboard into academia, this is the place. If your focus or your interest is in clinical medicine in a community setting, you'll get great clinical care here, and you'll learn how to take care of the spectrum of patients that we see, from VA patients to indigent patients to the high-end socialite crowd. We see it all, and you'll learn how to interact with these various groups.
I think that the most important skills that the fellow can learn during this year of training are those around how to troubleshoot and how to problem solve with their patients going forward. So I think the fellowship helps the fellow build a base of skills upon which to diagnose patients, do initial evaluation, and then hopefully have a good treatment plan. But all these things will change. So I think the most important thing is trying to build upon those skills so that when they're faced with a novel situation in the future, when they're on their own, that they can draw upon the skills they learned in fellowship to try to tackle that problem. Truly, I think that's the most important thing that they can gain out of fellowship.
I think one of the key attributes that I'm looking for in a fellowship applicant is the intellectual curiosity. They need to be interested and seeking to know more about what each condition, each patient really present with.
You know, it's obvious you need to learn the information that's essential to practice in our field. So the book knowledge. It's obviously essential to obtain the surgical skills required to do an IOL exchange, to do a corneal transplant. But I think in more general terms, you really want as a fellow to develop the skills required to acquire new knowledge throughout your career. How do I learn? How do I continue this process of learning? And I think during your fellowship, obviously you have mentors who are teaching you. When you're in practice, you don't necessarily have named mentors. And I think what we teach our fellows is you're always learning. You're learning either from your mentors or your colleagues, and that is not something that stops when you finish your fellowship. That's something that continues throughout your career.
Very collegial and also very nurturing for people who are interested in a career in academia. Because here we have clinical faculties who are very good at the clinical work, and we have also clinician scientists who are also very successful in carry out translation research, clinical research. So I think that under this environment, very unique environment.
When you leave our fellowship, your practice really shouldn't be limited by what you were and were not exposed to during your training. You're going to be pretty much exposed to everything. It's really going to be limited by what you want to make as your practice emphasis.
Oh, my job is the best, actually, but this is not what you're coming in for. But the cool thing about cornea, I guess, is that if you have some sort of eye condition, you know, the cornea surgeon does a surgery and it gets sent to me, and I'm the one that gets to give them their 20/20 vision after their transplant. So it's just so rewarding, and I love my job. So I hope that that excitement is shared when, you know, we work on patients together.
I really enjoy working with the fellows because it's very rewarding to see them kind of grow up like what I did before, and now I'm on the other side, and they have taught me a lot as well, and I learned from them. And over the last more than 10 years, and we have many different fellows come through, and some of them gone to academia, some of them in private practice, and they are doing very well.
More important, I think, as we get older, when you're thinking about your legacy through your children and through the people you have trained. So I really look forward every year to seeing the new applicants, and the people who are now fellowship applicants soon will be fellows, and then after that will become colleagues. And I think of those that we've trained at Stein as sort of our legacy, and it really makes me proud to see how well so many of our fellows have done since they've completed their fellowship training.